So our practice, which is Just Heart Cardiovascular Group, is predominantly a cardiovascular care practice, but then we have internal medicine, with it. And we service the area of Baltimore, both the city and also in the county locations. We received a kind of a message from Core Virtual through LinkedIn, indicating that they can provide such service. And that has been a service that we actually had always wanted to look at, And so we did respond and say we needed to know, practices of who they have worked with for us to interview and get a sense of. And they did provide some of, reference. So then I did reach out to those three individuals to discuss their practice about CORE. And, based on the feedback I got from them, I said, okay, I will pursue it further with CORE. There's been significant improvement in patient engagement and also freeing the staff some time so the staff can do, to do other things while the VA is helping out. And then also a certain level of comfort for the staff to know that there's a backup of somebody they can reach out to do certain tasks if they cannot get to that task immediately. So that kind of comfort really makes it easier when they're in office to say, okay, maybe this phone call can go to the VA. Okay, maybe I can just send a VA note to, call this patient for me and find out, or even call the patient for the next day appointment. So certain levels of comfort and burden has been removed. With CORE, the things that impressed me on how they operate was when I was seeking to find somebody, and when we finally made a choice, they also assigned somebody, a staff, to work with that VA to make sure that they continued, ongoing feedback for success. So, which is important. And that feedback not only goes to the practice, but also goes to the VA so that everything can be worked well to ensure that there is a success in that. So yeah, I would recommend CORE for that, yes.